Yeah, hello. I'm Eva Kimby. I'm a professor emerita from the Karolinska Institute in Stockholm. And I had the pleasure to be the organizer of the fifth international workshop on Waldenstrom that took place in Stockholm 2008. And my co-chair was Stephen Treon. The scientific workshop was attended by like 80 colleagues from all over the world, and both advances in biology and treatment was presented. The opening session and the ceremony was in the Vasa Museum, and Dr. Robert Kyle, he gave the Robert Kyle Award to Professor Véronique Leblond from France, and that was a very nice moment to see. Another memorable moment was when the award to the young scientists was discussed, and that was in the Old Town in the Nobel Museum. And now to the scientific part of the meeting. There were many important takeaways from this meeting. I think that the important insights into genetic basis of Waldenstrom was interesting, like the role of the deletion of 6q. But it was not until many years later that the mutation were found by Steve Treon. So the MGUS, the monoclonal gammopathy of undetermined significance, were discussed by Dr. Kyle and Dr. McMaster, and also they discussed the familiar nature of Waldenstrom, and that was also Dr. Christensen's subject. What I also find was interesting was the influence of the microenvironment, and that was discussed by Dr. Ansel, presenting data on CCL5, a cytokine-inducing secretion of IL-6 by the bone marrow stromal cell. And Joshua presented data on the regulatory cytotoxic T cells, a specific subset, and they were depleted by the purine analogs. So patients getting this type of therapy might have a higher risk of transformation. So different strategies of more modern treatment was discussed, like rituximab. Now we use rituximab in every patient nearly, but a lot of different protocols were discussed by Dr. Bosque and Dr. Dimopoulos. Then, of course, we had a closing ceremony, and that was in the Blue Hall of the Stockholm City Hall. And the Blue Hall is a place for the Nobel Prize winners, and they dance in the golden room, the Golden Hall. And in the Golden Hall, we had our dinner and also the presentations from Dr. Anders Waldenström, who was the son of the real Professor Waldenström, who gave name to the disease. And he gave a lot of nice data of his father's career. We also, in this place, had the presentation of the Waldenström Award to Dr. Dimopoulos, Morell, and Marilini. The day after our workshop, we also had a specific meeting for a patient-doctor forum, and also Ask the Doctor panel was on place. So, in my opinion, the many workshops of Waldenström have been very, very important, because all the colleagues now, both the researchers and the clinical doctors, they feel like a family. And that is very important for further networking and for further progress in science, both in the clinic and in the research lab. So to the young attendants of this workshop, I really want to give some advice, and that is that you should work in a field that you believe is of most value for both research and patients, and you should keep your integrity and never give up. See you there, and bye-bye.